Hey, my name is Benjamin Tanner. This is my friend, Dr. Mary Jolene Holloway. Did I say that
Yes.
correctly?
hmm
And we are trying to sort out and get some information just a little bit more clear on things that are going on in the medical world. So specifically, the COVID-19 virus and the vaccine. So I've gone through and I've done a little bit of research and digging to try and find some of the primary reasons, questions, and things that people are concerned about. So I found that in my own studies, perhaps due to a lack of education, I had quite a bit of trouble discerning what specifically a lot of the documents were talking about. So not entirely, but I was surprised at how hard the information was to assess. So that's where I'm bringing in my friend here who has a PhD, so she can kind of help to iron out the kinks and get everything sorted out for everybody else.
I'm happy to help.
So,
Yes, my PhD is in medical sciences and microbiology. And so I'm happy to help and answer any questions that I can.
very nice. So, my basic stance or my reason for conducting research is not only to protect myself, like I said, but also my family. Um, and the reason for doing so is that I have about 15 people that expect me to give my best medical opinion on the state of affairs. And probably, I'd be willing to say about 7 times that by the law of affiliation. So, friends, associates, etc. Um, and I myself am a second semester nursing student, and then this is again Dr. Mary Jolene Holloway. I wrote that out. Anyways, but yeah, so let's talk about some blood types. So I know yesterday you and I had briefly talked, and one of the interesting pieces of information that I kept coming across was that there was a key correlation between the COVID-19 virus, or the virus and all of its wonderful new strains, seems to be attacking blood types A and AB over blood types O. And I thought that was a very unique characteristic or thing for a virus to do. So I was wondering if you could speak about that at all.
Sure. What's going on is that with the SARS COVID-19 vaccine that or virus that we're experiencing now does have a particular susceptibility to bind to the A antigen that's present in both A and AB blood cells or blood types. And so what's going on with this is that the virus is coming in and binding more easily to these two blood types. And they're mimicking kind of the receptor that the virus binds to. And what happens then is that the A and AB antigens are found more so on respiratory cells, and therefore the virus can more easily get into those cells by mimicking the A antigen and binding.
Okay, so to kind of break that down a little bit. So when viruses enter cells, they have receptor sites, and these receptor sites are their antigen binding sites. So for people who have the blood types A and AB, they have receptor sites that are more similar to that of the virus. Is that correct?
That's correct. And that's why it can bind. What is happening with this virus, if I can just describe it in general, how it gets into the cells, it enters the human cells after binding to something called angiotensin enzyme controlling enzyme ACE2 receptors. And now we can just call it ACE2 receptor just to keep it easy. So it's the receptor binding domain where the virus attaches its spike protein to. And that spike protein is what the vaccine is actually targeting against from to make it not be able to enter the cell. So the vaccine is an mRNA transcript that goes in and asks the cell to mimic the production of that spike viral protein so that the cells will then recognize it and and make immunity towards the virus if it encounters it again.
Okay.
And
So
so it's the virus is utilizing that spike protein for attachment and subsequent internalization into cells. So one thing to note though is that it's an mRNA vaccine. and it never gets into the nucleus of the cell, so it will never mess with the host cell DNA. It remains in the cytoplasm, and that's where the proteins are transcribed to mimic this spike protein that's on the virus.
Okay. So could you help me understand this a little bit better? So I understand what you said about it not entering the nucleus and not messing with the DNA. So for anybody else, the DNA is kind of like the computer code that runs everything, and the RNA or the mRNA is kind of like the messenger that the cell uses to get things done. So in basic terms, that's kind of the gist of what she was saying. So the vaccine that is inserted, based on what I've seen, is basically inserted into a cell, and then it helps to create a spike protein mimic, right? So
Yes, that is
like a
correct.
false um, like a false virus, right? And so the body would interpret this, and it would say this is a virus, and it would then begin the production of antibodies against this spike protein, which is causing so many problems. Is that correct?
That's absolutely correct.
Okay. So another thing that came up rather commonly, and I think that it's something that's on the hearts and minds of a lot of different people, is that this virus absolutely targets the elderly and it targets the sick. So there is an age-related component to COVID-19. When I was doing my own research, one of the things that I came across was that um, COVID-19, the elderly have a 1 in 3 chance to end up on the ventilator, where children have a 1 in 30 chance to end up on the ventilator. And so what is happening is that you're having a ton of kids going to school, and they're actually acting like the vectors in our community. They're acting as like the fleas, they're spreading it. And so they'll go and they'll hang out with their infected friends, and they'll come home to mom and dad, and then mom and dad will get the virus. I know for myself and my friends and some of the people in nursing school, they've come in contact with the virus by this mechanism. And in my own family, like, I've asked my nieces and nephews who are, you know, lower than the age of 10, and then they're like, we're not doing any type of precautions or anything. And I feel like the whole community is kind of has this veil of unknowing, right? And so they
Right.
don't fully understand what's going on, and because they don't understand what's going on, the virus is just allowing itself to precipitate and mutate and continue this vicious cycle where the hospitals are filling up again and people are continuing to die. So if you could talk a little bit about what you found related to age-related sickness and how this virus, or why this virus kind of goes after individuals who are elderly. Or
Sure. When in comparison to children and people who are younger adults and even middle-aged, the elderly have more of a immunosenescence, or their immune system gets less strong as they age. And so you'll see a spike in susceptibility to cases in cases. Once you reach 60, it goes exponentially up as you get older than that. And so children have naive T cells and B cells and memory cells that are able to form to target the virus. And so that's why they have these milder cases, because they have a stronger immune system. Same with adults that are, between their 20 and 50 years old. At this point, their immune system is strong, and it's been triggered to react to different illnesses throughout the years. And so it's able to respond more quickly to it. Whereas the elderly, along with their immune system not being as strong, they also tend to have more comorbidities as they go along, like diabetes, cardiovascular disease, lung problems like COPD, that make them much more susceptible to the virus and having more severe illness.
I'm glad you said that about comorbidities, because I was going to bring that up. One of the key factors that keeps coming up in a lot of different research is that people who have comorbidities, I guess the present to date number, but this might change, is 4 more comorbidities put you at a very high risk of ending up on a ventilator and dying. So
That's
if you have
unfortunately true.
So again, hitting that immunocompromised or individuals within our population who are less than fortunate. So I think it's very difficult because especially, like in America, a lot of people have people that they care about who have, to a certain extent, some type of comorbidity, right? And so
Yes.
it, um, it's it's very challenging when a pandemic rolls through and basically just starts picking people off, right? And I honestly, I hate to use that type of terminology, but how many people do you know, like in your own personal life, have, you know, unfortunately been taken or affected by this? I myself have had
Mhm.
a tremendous amount of people affected by it, and I've even had some people taken, not only with me, but close friends and family. Um, and what's happening is that, um, again, going back to that kind of unknowing, right? It feels like the world, and I don't want to single this out to any country or any organization or any group, but the world is just mandating the fact that every single person has to get this virus. So many other countries have mandated the fact that the vaccine is mandatory, right? And so if it's fully based on science and not fear, that's great, right? That's how we got rid of polio.
Right,
That's how we got rid of smallpox and a bunch of other things that like
right.
were catastrophic to the human race. Um, but on the same notion, we came up with a vaccine for a virus in a very short period of time. Now, I am the first person to jump on board of human ingenuity and say that we're humans, we can do it. That's exciting because if you have a million, a billion people, there's 7 billion people on this planet. If we have 7 billion people all working towards the same goal, we can get done anything very, very quickly, right? So the time element doesn't surprise me. But to me, the thing that really concerns me is the fact of what it is, the science behind mRNA vaccines, because one of my own personal interests in my life is genetic engineering, and obviously, this isn't my field of study. I'm going into medicine so that I can help people and I can form my life into a way that I can live it how I want. But I have spent some amount of previous education and research dedicated to this. And one of the things that I've come across is that the way that this vaccine is made, right? So specifically the
Mhm.
mRNA, us injecting our cells with instructions to do something.
Correct.
Um, it harkens really closely to genetic engineering, in my opinion. And if that was it alone, I could say that's fine, right? If people had a very good track record of being good at playing with different miscellaneous body systems or organs or chemicals, I'd be all about it. I'd be like, wow, that's really cool. But like for example, in pharmacology, when you do one thing, like if you convince the body that one thing goes right and then like 5 to 10 other things go wrong, that to me, it makes me as an individual very cautious, right? And so this is just my
Mhm.
own personal thoughts, my own personal fears. And presently in America, about 50% of the population are unvaccinated. So I'm sure I'm not alone in this. Um, are you able to, so again, PhD in microbiology is completely different than, um, you know, just going to school for nursing, and prior to this I was in biomed. So can you speak a little bit to that, so specifically to the development of the vaccine and how um, it it developed, like kind of the science
Sure.
behind it, and just make it simple for other people as well.
Sure. I know that a lot of people are under the assumption that this vaccine was made very quickly. However, there were studies doing vaccines for cancer using the very same or similar technologies for the past decade. And so we just modeled the vaccine after those cancer vaccines, but instead targeting it towards the COVID virus instead, is the short answer and simple answer for that. So the technology for this and the way you think about it and what it does to the body has been studied before in cancer patients who have gone through the clinical trials of getting these vaccines. And so that's why they know that, they are able to predict some of the long-term effects of it, as well as they were able to quickly come up with a mechanism that instead targeted the vaccine instead of cancer, or the virus instead of cancer.
Okay, so it's basically just like a modified strain that would have before attacked cancer, but now it's attacking the virus.
Yes.
Okay. So something that has come up a few times and something that I myself am um, concerned about is the idea or the concept of health complications coming from the virus. So not the vaccine, but if you get COVID-19, right? And then 6 months down the line, essentially adding comorbidities to previously healthy people. So like, for example, I myself am presently unvaccinated. And, as a young man, I find that very terrifying because it's like, well, hey, I work out, I eat healthy, I go out of my way to maintain a healthy lifestyle. And now if I don't get the vaccine, there's a potential that I could end up with like a higher chance of clots, right? Okay, so one of
Mhm.
the supporting evidences of this is that the um, the average amount of people who are having heart attacks and strokes, and for everybody else, the basic idea of a heart attack and stroke, or one of the leading causes, is that a clot will go through those tiny blood vessels in those areas, so your brain and your heart, and that's how people die. That's how they have heart attacks, and that's how they have strokes. Um, but it went up sevenfold, like 7 times the amount since the outbreak started. And that's a lot. That's huge, and that's terrifying, right?
It
And
is.
so another thing that came out was that a study in Israel, and this was based not on the research that I've done, but on an interview that I've watched with Dr. Rwanda. I think I'm saying her name wrong. One second. Dr. Rwanda. I will create a link citing it if I don't pop it off quickly. But basically, she said that she came across some research that was out of Israel, and what they were doing was they were taking brain scans of individuals who um, they were having a higher incidence of stroke victims in the population. And so, if you know anything about Israel, they're on the cutting edge of technology, and they try very, very hard to be as precise as they can be with all of their science. And so they were having a lot of stroke victims, and they did brain scans on a large general population of people in Israel. And what they found was that for those who have had COVID in the past, that they actually had a degeneration of gray matter in their brain. So what that means is that um, before COVID, they were at like, say, an intelligence level of 8. After COVID, they were at like an intelligence level of 7, because this virus actually affected their gray matter in their brain. And her name is Dr. Rohanda Patrick. And so she has an interview on the Joe Rogan Experience, which is like a popular American thing, and they are very good about their research and data. And so she is a doctor to my understanding, and she has her own website and resources on there as well. So I found that to be very um, notable, but more than anything, like really concerning, because obviously we want to be as healthy as possible, especially in the time of this pandemic. So,
Right.
um, are you able to speak on anything like that? Have you come across any similar research or data or just anything?
Yes. What the virus does is it gets into your immune system and causes inflammation. Very simple inflammation that it's going to cause, like where your immune system is attacking the virus and some of your cells are getting inflamed. And so, in combination with the inflammation and the immobility of COVID virus patients, I'm saying immobility because they're confined to the bed. If they're very sick, under serious conditions, they'd be intubated. When you combine the inflammation and the immobility together, it creates a near perfect environment for creating clots, or something called a thrombocytopenia syndrome, where you have a low platelet count, but yet the environment to create blood clots. I know that sounds, weird, where you're having low platelet counts because they're in charge of creating, the clot when it needs to. However, it also can lead to these blood clots. And these blood clots can travel and cause a deep vein thrombosis, or a DVT, in your legs from just laying there. Or it can then dislodge and come up to your heart, into your lungs, causing a pulmonary edema, consequences down the line. Or it can even cause a stroke if it goes into your brain. So there is evidence that does back that the virus, it has the capability of causing long-term blood clotting effects.
So, and that's even after they have the COVID. So if it creates the perfect
Mhm.
environment while this is happening, the likelihood of this happening over time goes up.
Yes, it does. And the more confined you are to the bed, while you're resting, or in the hospital in the worst case scenario, you are more prone to even getting a DVT, even without the inflammation, just because of your leg sitting there without having the circulation go through it when you're normally walking or doing things around the house. So you can get a deep vein thrombosis that you don't even know is there. But then if you recover and get up and walk again, then that's when that clot in your leg can dislodge and go to other parts of your body. And that's where we're seeing people with strokes, with heart attacks, with lung issues. Does that answer your question well?
It does. It does. I'm glad that two people doing research are coming up with the same things. That's encouraging. So, um, common cold versus the virus. So I try and pay attention to people who, um, I hate to say that this has gotten political, but I think it's clear at this stage in the game is that, um, unfortunately, getting the vaccine has almost become a type of political debate, which to me is crazy, right? It shouldn't be
Yes,
political because it's about public health.
it's a
And for
public health
medical
matter.
professionals, it's about taking care of people, right? And so you
Hmm.
can't effectively take care of somebody if you yourself just ended up in the same place, right? So like
Right.
if somebody had polio, I wouldn't like want to go take care of somebody with polio because like you know what I mean? Like that sounds crazy, but this is a very similar situation. And one of the things that people keep referring back to is they're like, oh, it's just the common cold. But realistically, it's not. It's not the common cold.
No.
So I was hoping you could kind of help break down the differentiation between the common cold and this strain of pandemic virus.
This strain of pandemic virus is much more deadly than the common cold, just because it can get into the deep cells of your lungs, your alveoli, where oxygen transports across. Whereas common colds, you can have a head cold, or you can have, like where it gets more into your upper respiratory system, but it doesn't get down deep into your lungs. And one other thing to consider is that the common cold is caused by the rhinovirus, but there are over 200, maybe 300 different strains of the common cold that you'll experience throughout your lifetime. So that's why you experience a cold. They have a cold season every year, and a different strain can be prominent. And that's why you can get sick with the common cold, once or twice per year for all of your lifetime, because you might never encounter all of those 200 strains, because we don't live to be 200 years old. But it's a much more mild infection just because of the cells that it's targeting, um, and the way that your immune system can get rid of it much more quickly.
Yes, I completely agree. And um, it's just it's traumatizing when you know, you have this impression or even like false impression from people who've gone through school and they're relatively educated, but they throw these pseudo statements around, right? And so I think that one
Yes.
is really, really common, and they say things like, oh, well, look at how often the common cold kills people, right? And but they're not actually accounting for the average death rate, because they're combining and skewing data. Um,
Hmm.
but like I said in the beginning, like think about how many people you know in your own life who've been affected by this. Many people who have their own family. I
Hmm.
remember when the pandemic first broke out in 2020, a year ago.
Yes.
Oh, nursing school making me lose track of time. Um, I had a friend of mine who had family overseas, and it affected other countries way worse than America. And there were some very ignorant people around the community that we were hanging around. And he was like, I've lost, like three uncles and my aunt and my third cousin. And he
My
lost
gosh.
five family members. And, his family was from Italy, which was hit the hardest, but that's crazy, you know? Um, and so it's really like I really want to emphasize that this is not the common cold,
No.
from everything from the way that it attacks your body to the fact that it spreads. Um, and I think
And
that's
where
a
it spreads.
right, and it lasts on surfaces. Um, I feel like this is somewhat more common, but I still want to brush up on it. Is that the way that this spreads is droplet. Okay, so if you're coughing,
Hmm.
all right, the virus is going to be heavier than air. So if you're it's very, very tiny droplets of particles that are going out. So that's why, like, if I were to spit on you and it would land on you, that would be an example. Or if I were to spit on the surface,
Right.
it would stay on the surface, right? And so one of the things that, I think I heard in the beginning of this whole pandemic, and less so now, is that well, why do we wear masks? Masks don't help, right? But they do, because it's not about
Absolutely.
stopping the spread of air, it's about stopping the spread of water droplets, right? And so by putting on a mask and maintaining that safe and healthy environment, like for example, in the nursing world, in the hospital, pretty much anything medical right now, we have face shields and masks. Because if Joe down the way coughs, I don't want to get it on my face. I don't want to get it on any orifices, any like cuts, any lesions. And so we're in this like very, very susceptible um, environment. Like the world right now is just this giant susceptible environment. And if this virus continues to mutate and continues to stick around, there's a very good chance that this will maintain and this will continue to be a thing, because
Right.
it like that's what it means. Because um, if this virus continues to spread, which it has done, right? It's a year later, we're still having problems. Um,
And new
then
variants coming up that are
and
even more transmissible.
right, then masks are probably going to stick around, because masks are creating a barrier in between the water droplets which are spreading the virus. Right? They don't do
Right.
anything
It's
if
your
you take
first
your mask off and you spit on your hand and you shake somebody's hand. Now it's in their hand, and or wherever, right? But that's kind of the
Mhm.
idea. Like a glob of spit is like a lot when you talk, or when you like say it, don't spray it. That's a small amount, but it's still how it spreads. So I just wanted to,
Right. Talking, sneezing, coughing, all of these things. So that's why the mask is your primary line of defense from getting anything into your body. And I'd just like to point out, when you wear the mask, you need to make sure that it covers your nose as well, so that you're not breathing it in. Because I've seen a lot of people just wear it over their mouth, and leave their nose, and you're only getting half the protection that way. So you have to wear it so that it's not being able to be inhaled. Someone that sneezes, in Walmart 10 feet away from you, a sneeze, they say, can go up to 20 feet. If it's a really good, achoo kind of sneeze. And so you got to protect both your nose and your mouth.
those grandpa sneezes.
Yes. Yes.
uh, okay, so I know we briefly mentioned this, but I just want to hit on it real quick. So a very hot topic, and I'm just saying this lightly, right? A lot of people, especially a lot of American people, are very they're passionate, but they're very afraid. And really, if you boil it down, it comes down to fear, and they're afraid of forced vaccinations. And to a certain extent, we're kind of seeing this, where
Mhm.
if you're working in a certain profession, they're like, hey, if you're going to be around this, you need to be vaccinated because it's a safety hazard if you're not, right?
Mhm.
But, you know, one of the things that I feel like people are afraid of is for forced vaccinations is they're like, well, they're taking away my freedom. But historically, there have been forced vaccinations, and that is how globally we have gone through and just eradicated some of the worst plagues in human history, right? So, for
Like
example,
polio.
like polio, exactly. Um, and so for anybody, right, I would just like to encourage them that if it was not as serious as it is, that wouldn't even be considered to be like on the table. Like the reason why that's even being talked about is because hospitals, ever since this has started, have been in a completely overwhelmed state.
Absolutely.
My classmates who work in the hospital, not even as nurses, go through and they watch hundreds of people die. I mean, and you probably know people. Like for example, like my sister's lawn
Yes.
man, he passed away, and he was like a young dude, and it's like that's that's tragic and that's unfortunate. But like every single time somebody gets sick to the point of beyond they can take care of themselves, they end up in a hospital, right?
And
And
then
this
once you're
is
in the hospital and you're intubated, or put on a ventilator, then it's really a Hail Mary to get them off of that ventilator and, relieve them of the virus. Once you get on that, it's really, I don't want to say it's a death sentence, but your odds of survival really go down once you're put on a ventilator, because at that point, the virus has destroyed a lot of your lungs.
Yeah, I completely agree, and I think that's one of the most terrifying things because based on what I've seen, if it progresses to the point to where you end up on a ventilator, your chances of survival are very bad.
Slim. Hmm.
Um, and you know, that's just the reality of the situation. So, I mean, obviously, we're doing everything in our power to keep people alive, but um, there's kind of only so much that you can do. And so this is kind of interesting because I want to talk with you a little bit about this because I feel like you might know more. Um, to my understanding, we are going through essentially like symptom management. Like if you get the vaccine, you have a fighting chance against the virus because it teaches your body how to fight it. If you don't get
Hmm.
the vaccine, I mean,
You have no natural immunity against it, and your body is up against the virus now. And one thing is that if you have the vaccine, then you're less likely for the virus to get into your lungs. It might get into your bloodstream, but the antibodies that are against it from the virus or from the vaccine are going to recognize this and be able to build up an antibody response much more quickly than if you acquire the virus naturally, because then your immune system doesn't recognize anything and it has to make these memory B cells or antibodies before it can even start working against it. I mean, you have your natural line of innate immunity that goes first, but really what we want are the targeted antibodies against it. And so what's happening even with I should mention with breakthrough cases, what we're seeing is that they're milder symptoms because the immune system is able to build up that immune response better. Your B cells and your T cells that help make the antibodies are going to have a much quicker and rapid response to the virus. And so therefore it won't get into your lungs, where again, the receptor that the virus likes to bind to has an affinity for the lungs. So your body is able to clear it before it can get there in most of the breakthrough cases. So that's why we're seeing more mild or even asymptomatic cases.
right. And I'm glad that you said that because it again, one of those misconceptions that seems to be floating around is that if you get the vaccine, you're safe. And unfortunately, the reality of the situation is that a lot of people, and when I say a lot, I mean like most of the people who are testing positive for COVID are vaccinated. Like that's a fact. And that doesn't mean that they're ending up in the hospital dying.
Right,
right? It just means
right,
that they came in contact with the virus, and now they've been degraded from a major thing that's going to kill you to, well, hey, you might get sick for a few days, and even if it is
right.
bad, right? Um, it's
Yeah,
not
it's not going to
going,
be
it's
pleasant, but it's not going to be as severe.
right. It's definitely not going to be nearly as bad as it were. And again, everything is kind of compounded by the fact of if you have comorbidities, if you're old, if you're over the age of 65, these are all additive factors. So you could be like over the age of 65 and you could have 10 things wrong with you. You could get the
Right.
vaccine and you could still pass away from this because again, it's just going to lessen the symptoms. So if you had a death sentence, you basically now you have a fighting chance.
Like, for example, I'll be personal and share that my father has previously had throat cancer, and which makes him immunocompromised, after going through the radiation and chemotherapy 2 to 3 years ago. And so he was one of the first ones to jump on the vaccine bandwagon just because he wanted, and he works in the medical field as a nurse anesthetist. And so being around people that might have the virus, he wanted that protection. And even though he's vaccinated and already had the booster shot that the immunocompromised can get now from the Moderna vaccine, he still religiously wears a mask every time he goes out to even to the grocery store, sometimes to the mailbox if he sees neighbors out there that aren't vaccinated. And so, yeah, wearing a mask and getting the vaccine was the best choice for him, especially in the environment in which he works.
Yes. Um, so let's see here. This is something that I came across, and I was hoping you could kind of help me better understand it because this is one of the areas that my knowledge falls off a little bit. So, spike proteins are cytotoxic, and therefore they're bad. Um, I have studied biology, in my opinion, extensively. Um, right, so like I'm in
Mhm.
nursing school. I have a background in this, and I have been studying it for quite a while. And as far as spike proteins specifically go, I don't know. I'm illiterate. So if you could help me better
Sure.
understand what is the difference between regular protein and spike protein, and how does it fit into this picture?
Okay, the spike protein is what's on the outside of the virus that helps it recognize the cells to attach to it and get into the human host cells. And so that's why the vaccine is preventing against the spike protein from joining on the human host cells. So the spike protein in itself isn't necessarily cytotoxic. It's just helping with the attachment and the entrance of the virus into the host cell. What happens after that is the virus going into the cell and then causing the cytotoxic effects, which, the human host cell can try to fight off. In the worst case scenario, it kills the host cell, and gets lysed and then gets degraded. So the spike proteins are mainly just what helps it get into the cell, and the virus does the rest of it.
So they're basically like the gatekeepers. They
Yes,
like the
that's a great way of
magnetic
putting it.
locks that would attach onto it, and then from there, if
Hmm.
the virus gets in, that's when the mayhem causes. But the spike protein is the
Yes.
mechanism of action for invading the cell.
Yes, exactly. So that's what we're trying to prevent is the vaccine or the virus even getting into the human host cell by mimicking that spike protein with the vaccine.
And for people who aren't familiar with anything biology, basically, the virus gets into the cell, it will invade the cell, it will go into the central portion of it, and it will basically take it over like you're hacking somebody's computer. Once it's
Yes.
done that, it will teach the cell how to make more of itself. And as it does this, it will fill the cell with more viruses until the cell will burst. And when it does this, then it continues out and it manifests in this vicious cycle of creating more viruses through this process of creating viruses. Um,
Right.
and so that's why if you get sick, at first you go through like oh, I'm not feeling well. And then all of a sudden you're like, whoa, I'm not feeling well, you know?
And that because that's a huge spike in how many viral particles are now spreading throughout your body.
Right. Um, so again, so something that I've come across that I'm not super, yeah, I had trouble tracking down. specific information on. So vaccines causing antibody enhancement. So one of the things that people are being concerned about, or one of the arguments for, or like against getting the vaccine, is that these vaccines are basically causing antibody enhancement. So you get the vaccine, and then basically what's happening is that your body is creating a type of um, like a like an antibody, um, uh, bugger. Yeah. Um,
I'm not
the
sure.
gist of what it was that you would go through, and the it would kind of create like a super hybrid version um, of the virus, right? And so by introducing the antibodies or the vaccine into your body, what's happening is that you're creating a type of um, more negative effect, right? And so I was trying to come up with like a better way to articulate that, but I think that's kind of the gist of it. And again, like I said, my knowledge of it is somewhat deficient. So have you heard anything about that? Have you come across that at all?
Not really. What the vaccine is doing is, again, it's mimicking the spike protein. When you first get inoculated with it, your immune system then builds up this, instead of being naive B cells, they now become memory B cells, but they're specific to the virus. So it's not like they're going to be attacking other things or attacking the human host itself. And what happens is, with these memory B cells, then they'll recognize it the next time that it comes in contact, if or when it comes in contact with the virus again, and be able to build up a stronger amount of B cells and T cells that will fight against the virus more efficiently. But again, they're very specific to the COVID-19 virus. And so they're not going to interfere with any other antibody production.
Okay. Um, So, and here's something that has come across, and this is obviously not the consensus within the scientific community, but it is, I know with a lot of like Americans and other people who are like self-studied individuals, they believe that there are alternatives that are like holistic. And so this would be more of like the holistic crowd of like, oh, I can use plants
Mm.
to fight this off, right? So silver and gold or magnesium sulfate or whatever they're using to try and create a type of hybrid immunity. So I don't know how it was in your household, but growing up, my mom always like fed me a bunch of like miracle cures that she concocted from her garden, and she's like, "This will make you better. It's full of dirt," and I ate it, and I was like, "Wow, thanks," and it encouraged me to get better a lot sooner. But it wasn't necessarily any better for my health, right? And so I'm not really saying that holistic things don't work, but in this specific regards, um, have you
Right.
come across anything other than the virus to possibly help maybe fend off some of the more severe side effects? So I know for myself in my own personal life, I've been taking echinacea regularly, and echinacea is an immunity boosting plant. And so basically,
Mhm.
historically, what has happened is that if I start to feel sick or down or whatever, I take a couple echinacea, boom, my body has a little bit of like a um, a stronger reaction
Initial defense.
to getting rid of the virus. And then normally I
Mhm.
don't get sick and I'm like, cool, I'm healthy, and I go back to my life.
Right.
But obviously, if this is a strain of virus that's sticking around and we're constantly coming in contact with it and being exposed to it, um, I know, at least in my own opinion, I don't think like the standard typical things are working, right? Because if they were, there wouldn't be, hundreds of millions of people dead. Like that just
Right.
wouldn't be the cause.
Vitamin C and zinc and the other, just vitamins and minerals sometimes aren't going to be enough. Like, you need a stronger defense of your immune system, more specific attack on it, rather than just having, your generalized immune boosters, like you said, with echinacea, with zinc, with vitamin C, with, any other supplements that you take. I haven't heard of anything that you can take that would provide some natural immunity against the virus. And after getting the virus, you can be treated with certain things But one thing I want to mention is definitely not ivermectin. There is not enough research done on that it has anything to do with helping prevent or treat the COVID virus. Ivermectin is used as mainly as a dewormer in cattle and horses. And so unfortunately, people are taking this, but they're taking what the doses that are meant for cattle and horses rather than for people. In certain instances, you get a parasite infection, or a worm kind of infection, to make it simpler, a parasite kind of infection. And that's when a low dose of ivermectin is used, because in higher doses, it can be lethal. That's why we have the pharmacokinetics, to determine the drug dosage over the amount of time. And so not enough research has been done to prove that it prevents or has any treatment possibilities with the virus. So more studies can be done on it to see, because there has been an overlapping of things that we found, have targeted one thing, and then, oh, hey, we can use it for something else here, like a heart medication, a beta blocker, that can turn into a different kind of remedy for, say, diabetes. We have found an overlap where one thing can treat more than, the one thing that it was created for. However, with this one, we need to do some more research into it, because in severe cases, what it's doing is it's going to act like it's deworming you, even if the worms aren't present. And so then the worst thing that can happen is the shedding of your intestinal lining. And so when you use the bathroom and you have diarrhea, the worst cases is the shedding of the intestinal lining that you may have to have surgery to correct.
Yes, I've heard some absolute horror stories of people who basically, tried to take their health into their own hands. And to a certain extent,
Yes.
I would encourage people to take their health into their own hands. But, there's a reason that a person who is a medical doctor went to school for 12 years to be a medical doctor, right?
Right. He would know the
And
right dose and if it works and what works.
right. And so, I would say that you can get pretty far on your own, but you have to be very, very, very careful when using drugs, period.
Hmm. Because they're going to have side effects.
Yeah. And, if you can go your whole life without taking drugs, that's great. It's like the old
Hmm.
classroom saying, do hugs, not drugs, because there are a lot of side effects to drugs. And I don't
Yes.
think that anybody in the right mind can say otherwise. I mean, it's evident by just the way that people look after they do any drugs. So that's a very good point. I'm glad you brought that up, because I know right now that is kind of a more hot topic, and I'm sure with time it will
Hmm.
dissipate, but it will probably go through a phase where people are going to try and be like, wow, that was dumb. Whoops, you know.
Right. Right. It's like
So
saying I can eat chocolate every day and not get the virus. And maybe I just haven't come in contact with the virus. The chocolate has nothing to do with it.
right. Um, but yeah, no, it's that was a good thing to point out. And I would also like to emphasize the fact that in the hospital setting, if you have the virus, it's primarily symptom management. And that's not to say that if you're having such severe symptoms that you shouldn't be in the hospital, because if you can't breathe, um, what happens is that you have like a percent of oxygen, and especially if you get the pneumonia-like symptoms, which are the ones that are killing people, your level
Yes.
of oxygen is going to decrease. And after you get down past 95%, it starts to become very difficult to breathe. And as you continue to go down, and once you hit into like the high 80s, and as that percentage drops even further, your lung can and likely will collapse. And so if your lung collapses and you're not in
Right.
the
It can't
hospital,
function on its own.
you die, period. And
Right.
so a lot of what's happening, especially when you hear they're ending up on the ventilator, well, they're on a ventilator to keep their lungs working, right? Because these pneumonia-like symptoms are attacking the lungs. Earlier, when Miss Holloway said that the ACE2 receptor, it's part of a system having to do with the lungs. So the very
Hmm.
specific thing that allows it to get into the cells is helping it to kind of, in a way, like attack our respiratory system. And that's why
Yes.
SARS stands for severe acute respiratory syndrome. So
Good point.
um, so here's another question that is on the list, right? So does mRNA circulate systemically versus isolated? So when you get this virus, right, it's going to teach your body how to fight off the infection. And obviously, based on everything that we've said so far, we want to minimize, pretty much any foreign anything into our body, period, right? And so
Mhm.
one of the things that's coming across is that people are concerned that, you know, to what extent is this vaccine working and how is it affecting our body? Is it staying in one area? Is it moving around? The research that I've come across, it has stated that basically, um, while there hasn't been like an overwhelming amount of studies done on this, it does end up in your liver. So it's probably metabolized in your liver if it spills over, right? So if you have a cup and you fill it up till it goes over, the overflow will go to your liver and it will get
Mhm.
metabolized out of your body. Um, but to what extent, right? Okay, so I know we've talked a bit um, about it, and I I myself, like I still I the idea of teaching my body to do something still feels uncomfortable, right? And so in the past, old
Right.
vaccines, they'll go through and you'll introduce a dead organism, your body will eat it up and through a natural process. And in this natural process, it will um, then go through and then activate the memory T cells to go through to create antibodies to give yourself a much stronger immune response versus actually like teaching it. So, to what extent, right? So, if we inject it in the arm, is it going to go through the whole body? Is it going to create a system-wide immune response? Can you talk a little bit about that?
Sure. It's eventually going to cause a whole body immune response. What happens is you get the inoculation in your shoulder, in the deltoid muscle, and it's going to remain there for a couple of hours. And so that's what's triggering the inflammation and the shoulder pain as one of the side effects of getting the vaccine. But after a few hours happens, and this, can vary in people depending on the state of their immune system, then it drains into your lymph nodes. And you have your lymph nodes under your armpit there, and you have them in your neck here. And so once it gets there, it's going to meet with these antigen presenting cells, or APCs. And so, well, like we talked about the antigen site before, this is what the virus recognizes. So now these presenting cells are going to go to your B cells and your T cells that are circulating throughout your entire body. And that's where it's going to create the memory that if it sees the virus come into it, it's going to be able to attack it more quickly. So it doesn't just stay in the deltoid muscle, it will systemically travel through your body. And then, like you said, the liver is like the garbage disposal, place of the body where all the waste will go to, get rid of. Your liver can handle that amount that's draining from your lymph nodes, but in the meantime, before it gets degraded, it is going to create that natural immune response by these antigen presenting cells going to your B cells and T cells and creating the antibodies.
Okay, I got you. And so something else that is kind of interesting. So you sent me to scientific article. I went through and I read it, and they were talking about the different stages of vaccine development, right? And so they went through stage one,
Mhm.
stage two, and stage three. And presently, in the mRNA cycle that we're in, we are in the stage three cycle, which is where we're teaching our body what to do through the process of mRNA transcription.
Mhm.
Do you think that we're going to stay here? Do you think that we're going to continue to develop and make it more notable, more intense? Do you think that we're going to go through like three more stages and try and um, perfect it even better? Or are we going to
Yes.
stay where we are?
I don't think we're going to stay where we are, especially with these new variants coming about, the Delta variant and the Mu variant that's coming about. These are much more easily transmissible and have mutations from the original strain. And so therefore, we're going to have to work on vaccines that have create a higher immunity than the 80 to 95% immunity that we're getting from getting the vaccine right now, because the Delta and Mu strains might slip through on some of those, and those what are causing some of the breakthrough cases, even in the vaccinated people. And so I think that honestly, this might become an annual kind of vaccine. Maybe not annual, I can't predict the future, but it might become something like treating the flu, where we have to get a new vaccine every year. Because as you know, the flu virus in itself changes and can have various subtypes, like H1N1, which caused the Spanish flu of 1918. But it can also have H2N3 and various combinations of that. So when you create the flu vaccine every year, we're looking at the predominant strains that are going around the entire world, and then combining those top, maybe 3 to 5 strains in the vaccine that will target against it. So it might become something like that, where we're then targeting the most prominent strain, whether it be Delta, Mu, or something else that comes along. And so I think that this is going to be an ongoing process, not just against the original virus, but against now these variants that we're coming across that are becoming more and more transmissible.
Doesn't that seem like dangerous to you? So as you keep getting booster shots, it will boost your immunity for something, right? And so if you're like 20 and you get a booster shot every single year for 10 years, like I just as an individual, I find that very hard to believe that that's not going to come across with any side effects. So my personal
Mm,
reservations towards the vaccine is I'm concerned about long-term side effects. Like for example, eating genetically modified food. Um, there was no way to predict that because you can't see 20 years into the future.
right.
But if we need a booster shot every single year, like how long are we going to go through and tell our
Until we create herd immunity.
well, hopefully,
And
yeah.
that's the goal. That's the goal, is to create the herd immunity of over 70% of the population being vaccinated. And even higher than that, like back when they had polio, they were able to eradicate it because they did have something called Warp Speed 1 that the government and the public health both worked on in order to make the polio vaccine, first of all, more accessible, and then mandate it, eventually. And so once polio, after the vaccine was developed by Jonas Salk in the 40s, it still took until 1979 for the last case to be seen in, like the last predominant cases to be seen. And since then, there's been a couple of breakthrough places from other countries, but we haven't had a case in our hemisphere in North America since the 90s. And that was a very isolated incident. So, and as you can see, nobody's getting polio vaccine anymore. Just like with smallpox eradicated, you used to have to get the smallpox vaccine. Now it's been eradicated. Now we don't have to get the vaccine anymore. Like I didn't get the vaccine because I was born after 1979 when smallpox was eradicated. And so since I think what's going to happen is the same thing with this one, is that once we get to the herd immunity and get it down so that it's not affecting, people in the same way that it is right now, in such large numbers, then we'll see the decrease of the vaccine going down because we won't have to need it anymore.
I got you. That makes sense. And so another thing that for me, like going back to the genetic engineering element of it, because for me that's where I'm very interested and somewhat invested into this vaccine. So the article that you sent me to and I went through, it had an element to that, right? And so they were showing that there were some studies that they did where they were modifying the DNA element of the cells, and they were showing positive results. And so, do you think that presently, if the model is an RNA model, do you think that with time they're going to switch into a DNA model? I mean, like if you could just
No,
go in and why is that?
because of the mechanism of, like you said, how DNA then is transcribed into the RNA, and then which is then translated into proteins. What we're mainly targeting is the spike protein, which is the initial site of entrance into the cell. So we're not going to start with DNA when we could already start with RNA in the middle, which can then be transcribed into the mimicking of that spike protein.
Right.
And so we're trying to prevent the virus from even getting into the cell, not what happens after it gets into the cell. And so that's why it'll be so more RNA, and dead viruses. Again, they're not live viruses. There's no live virus in the cell. It's just a piece of mRNA. And so I think it'll just be the RNA viruses that will be able to create the proteins then that will protect the virus from getting into the cell in the first place.
Oh, I got you. Just to basically put that into a different light, the number one reason why we wouldn't create a DNA-based vaccine is because it's an extra step, right? You
Yes.
don't want to travel 5 miles when you can travel 3 miles, and the 3 miles is saving lives. You don't want to create something that takes more work. So it's more efficient to stay with the mRNA, which also corresponds with a higher safety rating for individuals. So
Hmm.
I know for myself that that helps to alleviate some of my concerns, um, and I know it definitely, for anybody else that sees this, is it's going to help them as well, because um, I always count on people to do what is convenient. And if you have something that works more efficiently, eventually that will always take over what is less efficient, right?
Absolutely. That's a great way of putting it.
So if this is a more efficient method of how it's going through and how it's completing it, I think that that's very encouraging. Um, so based on your own individual studies or anything that you've come across, have you seen anything or heard anything that you feel like is an important thing to talk about that we haven't gone over yet?
Um, let's just see. I think we covered everything that was on your list. So I don't know if you have any other questions, because I think we covered a lot of it. We covered how the virus gets into your body, how the vaccine helps prevent it, who are more susceptible to it. Oh, one thing that needs to be studied still, and I guess I could add on to, is age does play a role, but we're still looking into ethnicities, races, different things like that, that we're finding out. You know how unfortunately African Americans are more prone to get diabetes, are, is a certain race more prone to contracting the virus? We don't know this yet. And so more long-term studies need to be done to determine the susceptibility levels of that in different population groups.
That would be very interesting because I know Italy got hit really, really hard by this virus, and I know that some of the other countries, I mean, everybody's
Hmm.
been hit by it, but some countries have absolutely been hit by it to like a whole nother degree. So if that has to do with like if that country has a higher percentage of blood types that are
Hmm.
like A, B, or A, perhaps that
Or is
plays a
it some
role,
other factor
right?
like
Or
diet or race?
right.
Like they can play a role in it, but we have it hasn't been around enough, that long enough that we can have a solid answer towards that. We're still going to be collecting the public health data and analyzing, the positive cases.
All right. Well, thank you so much for your time. I appreciate you meeting with me.
Thank you. It was great talking with you.
You as well. All right.